everyone, I am Dr. Sandhya Deepika, consultant Ferty9 Fertility Center, Secunderabad branch. So today I am going to talk about a very common topic which is associated with female menstrual disorders and infertility, that is fibroid. So what are these fibroids? How do they affect infertility? And what are the fibroids which should be treated surgically? And what are the types of treatments associated with fibroids and infertility? So we'll discuss all these things. So first, coming to fibroids, what are these fibroids? These fibroids are called benign tumors of the smooth muscle of uterus. So normally uterus is divided into three layers. One is the endometrium, which is the innermost layer of uterus. Next is the myometrium, which is the muscular layer of uterus, and the serosal layer of uterus, which is the outer covering of the uterus. So these three are the main layers of uterus. This fibroid is a tumor which originates from the uterine muscular layer of uterus. Many a times, 90 to 94% of times, it's a benign tumor, which is harmless tumor. So there are many types of fibroids which are defined according to the space of existence of the fibroid. So mainly submucous fibroid, which is the fibroid which originates from the muscle and which grows into the uterine cavity. Second is called the intramural fibroids, means these fibroids which originates from the muscular layer and which grow there itself. These are called intramural fibroids. And the other section is the subserous fibroids, the fibroids which originate from the muscle but grow outside the uterine cavity. These are subserous fibroids. And the symptoms caused by the fibroids are like this. First is heavy menstrual bleeding. The patient presents with heavy bleeding during their menstruation. And the second is the infertility issue. And the third are the pressure symptoms. When the fibroids are very huge in size, they cause pressure symptoms in the pelvic cavity. So coming to infertility, the main fibroids which are associated with infertility are the submucous fibroids, means with the fibroids which are inside the uterine cavity. So why these are most important is, when the fibroid is inside the cavity of the uterus, it affects the implantation. Means the implantation is a thing when the embryo comes onto the uterine endometrium, it should get attached to the endometrium and grow. So this is called the implantation procedure. If the fibroid is inside the uterine cavity, this implantation is affected. So during the infertility treatment, the submucous fibroid has to be treated immediately so that the fertility is improved. The second fibroid is the intramural fibroid, means the fibroid which is in the muscular cavity. When this should be treated when the fibroid is closer to the endometrium or the implantation site, means where the embryo grow and attaches to the endometrium. If the fibroid is closer to this area, it affects implantation and affects the blood supply to the growing fetus. So that also has to be treated immediately during the infertility treatment. And the third is a subserous fibroid, usually which is far away from the implantation site, need not be treated during infertility treatment. Yes, it has to be treated if it causes any pressure symptoms or anything. So what are the types of treatment for in the fibroids and infertility? The main two procedures we follow are the hysteroscopic myomectomy, which we usually treat the submucous fibroid through hysteroscopic myomectomy, and hysteroscopic or laparoscopic myomectomy for intramural fibroids. If there is an intramural fibroid, the laparoscopic myomectomy means we use laparoscopic ports and we take off the fibroid and will suture the remaining muscle of the myometrium. That is called laparoscopic myomectomy. This is a common procedure we do to treat the fibroids which are associated with infertility. Thank you.